In Alberta, we are only allowed to use it for mid-femurs in Alberta. And we are only allowed to use 15 pounds maximum or 10% of the body weight. So she's not 150 pounds, so we'll have to do 10% of her body weight. So anyone up to 150, 10%, and anything after 150, you're going to do 15 pounds pressure max. Okay? So when we pull here, this is where you see how many pounds. This goes by pounds or kilos. Okay? And this here you'll see Sager up. So this part should be up. If it's on the wrong way, just push the button. And pull it out and turn it. And we'll do it the other way. Okay? This part here always goes towards the foot. Okay? So it would go in between her legs this way, and the wheel goes and points towards the foot. Take off your socks too. Okay. Okay, so this here turns. So whichever way you need it, it will turn towards the leg. Alright? So we're going to apply this way.
So you just want it on the outside?
Yeah, we're just going to do all the skills, not full, and we'll go from one to the other one, because there's lots of different splinting materials that we have to go through. So I'll just show you guys, we'll just do the skills for now so you guys know how to do it, and then we'll go from there. So this one here.
What determines what side of the leg you want to put it on?
Well, whichever injury it's on, right? So if this is the injury, then this is going to point towards that leg. Right? The wheel points towards the injured leg.
So by like forms, you just not using this splint?
If it's really grossly, if it's slightly, it would probably work. But if it's grossly, you can't unless you're realigned. If it's grossly,
well, I'm just thinking of like if the brake, you got it on the inside, if the brake went that way a little bit, wouldn't it hurt to have the pressure?
Then you couldn't use that.
You couldn't?
Okay, no, because if it's just slightly deformed like that, we're not supposed to realign, right? You're going to use a different material.
Okay.
Okay?
That always goes on the inside?
This always goes on the inside, yes.
So slightly deformed, you wouldn't use it?
No, because slightly deformed, we're not allowed to realign. Okay? We're only allowed to realign if it's grossly deformed. Otherwise, it's position found. You might want to take this off too. Okay? John, can you find an ABD pad in a red bag for me, or a triangular bandage? There we go. So I'm going to tie it to the top. Okay, this here moves up and down. Okay, be careful if you're holding it up because this is just going to slide right out. Okay, so you are going to just barely make it. Okay, this here is the stirrup and goes right over your foot. Okay, so this goes right over your foot like this, and we're going to tighten it up. Right under your foot. Okay, and she's got a pretty small ankle here, so you can remove the pads as you need to. Okay? So we want this right by her callus. And you want to make it fairly snug. Okay. And I think I'm going to make this even tighter. This loop here, you should maybe just have barely enough to put your finger. Okay. Alright, good enough. Okay, when I pull, when you apply traction, your patients need to be laying down, okay? I almost failed my EMR exam because of that. The scenario he gave me is guy, excuse me, fell down a small embankment. So I went to do C-spine to lay him down. No, it was just a small embankment. Okay, he doesn't want to lay down, he's okay, he doesn't, okay, so then I tried to lay him down again on my RBS and my head to toe. No, he just wants to watch and lay down, he doesn't want to lay down. Okay. So, I had a pulseless limb, and I had to realign, and I had to apply traction, and so he says, well, when you apply traction, you should be laying down. I said, I tried to lay the person down 3 times. Did you want me to not lay him down and not apply traction, or did you want me to apply traction? What did you want me to do? I tried to lay him down. So then all three of the evaluators left the room, chit-chatted, and they come back and they said, okay, I mean, if you want me to use it, which is obviously what they wanted me to do, then they should have allowed me to lay him down. And I tried 3 times and said no. So then, in that case, I probably shouldn't have done it, right? Okay, so the reason we like him laying down is because you need the weight. Remember, we grab above the injury and below the injury, and right now I'm just grabbing below the injury. The weight is above the injury, okay? If I just start pulling on this wheel, it's going to go tick, 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 and guess what? She's going to feel every tick, 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 tick. So make sure that you hang on to it so it doesn't happen. I know you're not going to like this, but 120 pounds, 12 pounds about? Okay, good. Most girls don't like to be asked that. Okay, so hang on to this, push it up into her groin, pull this out so it doesn't go tick, tick, tick at every interval, right? And start pulling. Okay, you're going to have to pull a little bit past, and it's going to relax right at 12. See 12? Check your pulse after. Okay, pulse is still good on her foot. So now you can take your speed straps.
What did you press to avoid it from ticking?
This thing.
If they start like yelling because it hurts so much, do you stop?
You know what? It's actually going to make it feel better.
Is it?
Yeah, it will. Okay, I doubt very much. It might initially just hurt a little bit, and then when you're done, they're going to feel the relief immediately. It's not going to make it hurt more. Okay? So, you got 3 speed straps. Put them here underneath her knee.
Above the knee?
You're going to go, just don't go on your buckles, right? You got 3.
And so above and below the injury isn't a part of these ones?
No, we just put them secure to the splint. Okay, so just don't go on your buckles, okay? Make sure that it's not on top of that. Make sure it's not on top of this either. Can I have a blanket, guys? Okay, still have a good pulse.
Now, I
Yes.
have to ask the obvious question that I know everybody's thinking. How do we guarantee we're on the ilius,
You're on what?
the tailbone, or the bone, the lower part of the crest? Because, okay, with her it's a different story, but I get one of these guys down there and I go to do that, and all of a sudden his voice goes up 3 octaves.
Well, you know what? Usually we have them place it up there if they can, and just ask them, what side are you dressed on, right? I mean, if you put it there and it's going to hurt, they're going to let you know.
Well, yeah, you're gonna get punched in the head.
No, they're going to let you know the minute you put it on there. Before you push, they're going to let you know. Okay, so make sure you ask them that or have them place that.
How can I guarantee?
For her, it
with the
doesn't matter.
crown That I'm gonna make sure that I'm down on that ilius crest.
Just put it in her crotch, she'll let you know, right? With us, it really doesn't matter, right? It really doesn't matter. For you guys, the minute we put it there, it's gonna matter. He's gonna let you know. So these are all the ones that you will be using, bring the good leg to the bad, that you will be using on your exam, right? These are the ones I'm going to expect you to be using on your exam.
Yeah.
And of course, you would still put your ice and do your secondary and all that. We're just doing the skills, how to apply it. Okay? So that would be your Sager splint. That's one of them.
So no need to have the long splint going up to the
No,
armpit?
no. Just, you know what's going to mobilize the joint above is your spinal cord.
Yep.
Okay?
So what would you use that Sager split for?
Mid-femurs.
Only mid-femurs.
Only mid-femurs in Alberta. Yeah.
What's up?
So for BC, you don't use this at all?
Yeah, we do, but we use it for more, and you'll get that when you do your course.
Yeah, okay.
We use it for mid to fib and knee.
Oh, okay.
I don't want to go there because
Yeah.
they can't.
Hey Linda,
Yes.
what injuries were it that we were supposed to put ice and which weren't we supposed to put
You
ice?
can put ice on everything unless you have a weak or no pulse.
Oh.
Because then it constricts your blood vessels and you're going to lose your pulse. So you can put it on all except for weak or no pulse. Okay? Okay. This one. Here, because look good.
Yeah.
Okay?
Yeah.
So we don't want it to do that, right? So pull it out.
That's the actual time.
Yeah. Yeah.